if you become stiff? Your body spasming at even the slightest touch? And no, we're not talking about an ED medicine reaction. What if your own body became a prison of rigidity and painful spasms? Imagine muscles so stiff they lock you in place, spasms triggered by the slightest noise or touch, and a life shadowed by fear of falling or even leaving your home. This is the reality of stiff person syndrome, SPS, a rare and baffling neurological disorder that affects just 1 to 2 people per million. Stiff person syndrome is a rare autoimmune neurological condition characterized by progressive muscle stiffness and painful spasms, primarily affecting the torso and limbs. But what causes the body to turn against itself in such a cruel way? Scientists believe SPS arises when the immune system mistakenly attacks the nervous system, disrupting the signals that control muscle movement. Symptoms often begin subtly, with stiffness in the trunk muscles, but can escalate to severe rigidity and spasms that make walking difficult or impossible. For many, everyday sounds or touches can trigger violent spasms, leading to falls and injuries. How do doctors identify such a rare and complex condition? SPS is often misdiagnosed as Parkinson's disease, multiple sclerosis, fibromyalgia, or even psychological disorders. Diagnosis relies on neurological exams, blood tests detecting specific antibodies like glutamic acid decarboxylase, CROG-GAD, and electromyography. Why is it so hard to diagnose? Because SPS symptoms overlap with many other disorders, and awareness remains low even among medical professionals. Stiff person syndrome, SPS, was first described as a distinct condition in 1956 by Drs. Frederick Morsch and Henry Woltman at the Mayo Clinic. They initially called it stiff man syndrome, after observing a series of patients with progressive muscle rigidity and spasms, including a notable case of a 49-year-old Iowa farmer who had severe muscle stiffness and painful spasms that made him appear like a wooden man. Over time, as it became clear the disorder affected both men and women, the name was changed to the more inclusive stiff person syndrome in 1991. Did you know that world-renowned singer Celine Dion has been battling stiff person syndrome? Her struggle brought global attention to this obscure disease. How does someone whose career depends on movement and vocal control cope with a condition that stiffens muscles and causes spasms? Celine's story is one of resilience amid uncertainty, highlighting the human side of this medical mystery. What about the strangest documented cases? Some patients experience partial SPS, where only one limb or part of the body is affected, while others suffer from a more widespread form that includes brainstem and cerebellar symptoms like double vision and speech difficulties. Stiff person syndrome is rare, but some cases stand out for their sheer strangeness and the mysteries they pose. Take Carmen from Liverpool, who one day found herself unable to cross the street, her body suddenly stiff and unyielding as if glued to the pavement. Initially misdiagnosed with anxiety, it took months before doctors uncovered the truth behind her paralysis-like episodes. Carmen recalls, "I felt trapped in my own body, unable to move or explain what was happening. The fear was overwhelming." Then there's the story of a young swimmer from Greece, Alexandra, who despite her diagnosis defied the odds to win a bronze medal, showing resilience amid the rigidity. Alexandra shares, "Every day was a battle, but I refused to let SPS define me." Meg, a physician herself, was diagnosed after years of unexplained symptoms, highlighting the challenges even medical professionals face in recognizing SPS. For patients who think that the lack of answers is because doctors don't make ordinary people a priority, Meg says, "Being a doctor didn't make it easier to get answers. SPS is still so misunderstood." Some cases are linked to cancer, where SPS appears as a paraneoplastic syndrome, adding layers of complexity and urgency to diagnosis and treatment. For example, a 60-year-old woman with metastatic breast cancer experienced worsening facial spasms and muscle stiffness. Despite extensive testing, it was the detection of anti-GAD antibodies that confirmed paraneoplastic SPS. Treatments like plasma exchange helped reduce her symptoms, though other therapies were ineffective. She admitted that, quote, "The diagnosis was a shock, but understanding it gave me a way forward." Other cancers associated with SPS include ovarian cancer, small cell lung cancer, colon cancer, thymoma, and Hodgkin's lymphoma. These paraneoplastic cases often involve antibodies such as anti-GAD65 and amphotericin, which may trigger the autoimmune attack on the nervous system. These stories reveal the unpredictable nature of SPS and the profound impact it has on those it touches. What can these unusual cases teach us about the disorder's hidden mechanisms? How do patients find hope in the face of such daunting challenges? For most, it requires a strength of character that not everyone has. Beyond physical symptoms, many patients develop anxiety, depression, and agoraphobia due to the unpredictability of spasms and fear of falling. The condition can isolate individuals, making social interaction and even leaving the house daunting challenges. Is there a cure? Currently, no cure exists, but treatments aim to manage symptoms. Muscle relaxants like diazepam, baclofen, and gabapentin can reduce stiffness and spasms. Immunotherapies and plasmapheresis may help some, especially those with paraneoplastic SPS. Physical therapy and psychological support are crucial to improving quality of life. Many questions remain. Why does SPS affect women twice as often as men? What triggers the immune system's attack? Could there be undiscovered antibodies or environmental factors involved? How can awareness and research be accelerated to improve diagnosis and treatment? Will we ever get the answers to those questions? Hard to say. Stiff person syndrome remains one of medicine's most perplexing puzzles, a rare disorder that stiffens the body and challenges the spirit. Through stories like Celine Dion's and ongoing research, hope persists that one day, this mysterious condition will be better understood and conquered. If you enjoyed this creepy but true medical history, hit subscribe and ring the bell for more medical mysteries then and now. Got a weird medical topic you want us to cover? Drop it in the comments.